more and more and more specialist. And the problem with that is you can find yourself very much being this person who knows everything about the smallest, most inconsequential thing, and you become this SME that is seen as somebody who can't manage people, is hard to get on with, or is too nerdy to show in front of clients. You put yourself in a very difficult position. If you can be open and presentable, then you're going to go a lot further.
If I gave you, we get straight into it. So if you can tell us a bit about yourself and your career to date, please.
Yeah, so my name is Phil Evans. I'm the Associate Director, QAQC at Zimmer Biomet, which is a large orthopedic implant firm with a global footprint based in Bridgend. My career has been all over the place. I started as a chemist with a PhD in making gas sensors and, of all things, electronic noses. Joined a company that started doing that and then ended up becoming a medical device company and doing 2 submissions to the FDA within probably about 18 months, which was an amazing journey. And then through a series of startups in really interesting technologies like PCR and other gas sensing technologies, stint with J&J, working with them for a little bit, and then working for quite a long time with GE Healthcare, going through various roles there, starting as a project manager and ending up managing a portfolio there. And some other consultancies, and now been with Zimmer Biomet for 5 years. Okay,
great. So has most of your experience been within quality? Is that right?
No. I started as an application specialist for the electronic nose company, which was sniffing things to see if you liked them or not, which is interesting. And then the medical device aspect of that was very interesting. So I proceeded then through project management. And then when I joined a company called Enigma Diagnostics as a project manager, I took on the quality role there. And I've been involved in setting up quality as part of the aspects of the eNose company. And then it's been a mixture all the way through then of running R&D, sort of discovery, new product introductions, and quality. So last 5 years has been all quality.
Okay, perfect. And could you tell us briefly about Zimmer Biomet? What do they do?
Yes, Zimmer Biomet's a global orthopedic company. The division that I work for, specifically in Bridgend, makes knees and hip implants. So sharp end of medical devices where everything we make goes inside the body. So you have a lot of responsibility there. And I think that's sort of a little bit far removed from perhaps when you start as an engineer and you've got sort of maybe some calipers and a big lump of metal in your hand, that ends up inside somebody's hip. And it's quite a privilege to work in an industry where you can give people their mobility back and change their quality of life. So really exciting place to work. Unfortunately, we're closing the Bridgend site. So there were 500 of us a year ago, and by the end of the year, there won't be really anybody left in the production site. But it's got a global footprint. We have sites in China, France, Germany, Switzerland, the US, and we cover reconstructive surgery, patient-matched implants, shoulders, heads, knees, toes, the whole thing. Yeah, so it's an exciting business to be in, and it's sort of different every day, which is nice.
Perfect. Thank you very much. Looking back, what advice would you give your younger self, especially when you were just starting out in your career?
Do something different. No, I think enjoy it. I think it's very easy to get very stressed about what you're doing, and be optimistic around the future. I think we go into it with very preformed plans or visions of how things work in industry, and I'm here for so long, and then I'm entitled to this, and then that will happen. And most people who are successful have very non-linear career paths. And you look at it, I started off, as I said, as an application specialist. Then I took over running a lab. Then I got into some project management. Then I got into aspects of quality. So I never thought I was going to do that. There's no real project plan for it. And if you do have that, I think you could be disappointed. And don't be shy of getting other skills. I think becoming aware of finance is useful, becoming aware of HR is useful. So somebody said, do you want to have a go of it? Try it and take on managing people and learn by doing. Otherwise, theory is not going to help you very far.
So almost have a plan, but be quite fluid with it in terms of trying new things and getting involved in other aspects of the business potentially.
Yeah, understand that it's good to have ambition and to sort of have the answer to, the horrible interview question. You know more about than I do, Rich, which will be, what do you want? Where do you see yourself in 2 or 3 years? And you're like, I don't know, in a Porsche. It's not. It's not like that. I see myself taking more responsibility. I see myself influencing bigger decisions in the company. I don't know if that's going to be in quality. I don't know if that's going to be in development. I don't know if that's going to be in commercial sales.
Sure.
And think about the skills that you need to be valuable to the business that they want to invest in you. So a lot of people in science think that they've got to get more and more and more specialist. And the problem with that is you can find yourself very much being this person who knows everything about the smallest, most inconsequential thing. And you become this SME that is seen as somebody who can't manage people, is hard to get on with, or is too nerdy to show in front of clients. You put yourself in a very difficult position. If you can be open and presentable, then you're going to go a lot further. So learn enough to keep going, but don't be the best. And that sounds stupid. But what I mean by don't be the best
of one very specific thing.
Don't specialize yourself into obscurity.
Sure. No, that makes sense. So for your career specifically, are there any skills or knowledge that you wish you'd learned earlier?
I wish I'd taken on more appreciation of, I guess, finance and I think sales and commercial. When we were at the medical device company, we were so fixated on making this device that could change the market for urine sample testing, right?
Mm-hmm.
Which is very glamorous. So urine samples, if you've got an infection, which is a very uncomfortable thing, a UTI, you give a sample, it goes off and it gets cultured, and you might get an answer within 48 or 72 hours. We could give an answer in 8.
Okay.
So it's a no-brainer, right?
Yeah.
But marketing-wise, we didn't think about how much it was going to cost. Paying somebody in a lab to play out urine samples is about 29 cents, because it was American, 29 cents a go. Ours per cost sample, just on the analysis, was like £1.80.
Okay.
So it was never going to sell because nobody needed an answer that quick. So yeah, so all the nerds had gone off and we refined this great thing and done clinical trials and proof of concept, but we're never going to sell it. So with a bit of kind of marketing and a bit of experience of finance and a little bit more awareness, we would have got to the answer a lot quicker. And so I think bringing the right group of people together is another skill. I think is to sort of listen to all the voices in the room and try and have a world view rather than your bench view.
Okay.